Okay, hello, and
Hi.
hi, Nina. Well, thank you for joining me on the Downtown Somatic Therapy video series, I guess we'll call it.
Love
Um,
it. Love it.
and Nina, I wanted to have you on because you and I both share a love of couples therapy, especially, which is not something that I've gotten a chance to talk about too much in this video series. But so I would love to talk about working with couples and working with couples through a somatic lens. But before we get into that, I would love to hear from you just about what drew you to working with couples, as
Mm.
opposed to individuals, especially.
Yeah. I think a lot of moments in my personal life, but I think most specifically or simply put, like I've always been fascinated by relationships, because they're where so much of our deepest joy and also deepest pain tend to live in our relationships. And of course, I work with individuals too. And with individual therapy, like I'm working to understand someone's inner world. And with couples, I get to understand how two inner worlds sort of meet and collide and get tangled up. Another way I've put it before is that like I think couples work was a really exciting opportunity to witness like a live relational system, like the living, breathing attachment system in the room in real time.
Yeah.
Whereas, with individuals, it's sometimes partners of our individual clients can become like phantoms in the room. Like they're not really there, but we're hearing about the system. And so to just have both parties within this system present is just like such an incredible opportunity to get to know how like love, protection, fear, longing, vulnerability, all those things show up between the two and within the system.
Totally.
Um,
I think probably every individual therapist has like a common experience of like hearing about someone, the other person in the relationship, and you only hear one side of the story and wondering what's really going on. And it is so satisfying. I think that is one of the nice things about working with a couple is you see both people and get to see what their relationship is really like, and for
Totally.
good and for bad.
Yeah.
How would you describe your style in particular? Like, especially
Mm.
in the room, how would someone know what you're like as a couples therapist?
Yeah, I think I mean I like to think of myself as warm. And then I'm also both I think deeply curious and observant, but also active and sometimes in couples work directive. In a tense moment, I'm often helping partners move like beneath defensiveness, criticism, or withdrawal. I'm asking questions like, what just happened inside you right there? What did you just hear them say? What are you hoping your partner understands about what you're saying in this moment? So, a lot of my work involves helping partners feel safe enough to be more honest about what's really like happening for them.
Hmm.
So, both directive and curious, sometimes I'm taking a step back to just witness what the cycle is, because oftentimes it's so helpful for me to see like, okay, what's happening out there
Right.
that you're here to address. And then other times, sometimes I am interrupting, I am helping partners slow down. I'm sort of serving as this like lighthouse or north star, like guiding them back home, like
Hmm.
helping them regulate and come back to what they're really trying to say and what's really like happening for them, beneath what they're verbally trying to communicate to their partner.
Yeah. Now you used a couple of words there, like regulate and feeling safe in
Hmm.
the room, and you know, for people who don't know you, you describe, some of your influences. You have a psychodynamic background. You're also trained somatically. You also work with attachment and attachment styles. And so when you use those words, like I want to underline them, right? The sense of safety or helping people
Hmm.
regulate. I'm hearing some of those influences there. But how would you explain your influences, your style, and how these things work together?
Yeah, it's a great question because I think, prospective clients and prospective couples interested in therapy read words like psychodynamic or somatic or
They
attachment.
they have no idea what we're talking
No
about.
idea what we're talking about exactly. Yeah. So I think simply put, I'm interested in Well, with those 3 words, I'm interested in 3 simple things, and that's your history, the relationships you've experienced in your life, and then your body. So with psychodynamic work is just helping me to understand how your past experiences have shaped your current beliefs, responses, reactions, also how they've shaped your experience of your partner. I'm also really curious as a couples therapist about who or what were some of the partners in the couples I see. Who were some of their early models of love and relationships?
Mhm.
What did they observe? What did they pick up on? What have they maybe internalized? And then the attachment work helps us understand like what happens for each partner when they're seeking closeness or safety or reassurance. That can look totally different with 2 different people, like how they
Mhm.
seek that, how they yearn for it, how they try to go about getting it. And then with the somatic, I'm just in a couple's session helping both partners pay attention to what's happening in their body, because as somatic practitioners, we know that our body often knows things long before our mind does.
Yeah.
So when we put all 3 of those together, we can start asking questions like, what has happened to you both in your lives? Like, how does that show up in your relationships today? And also, what is your body telling us about that experience right now,
Yeah.
even if you might not be aware of it intellectually?
Yeah. Yeah. I think to add to that, something that I think people largely think of somatic work as individual work, but um, couples work is such a good opportunity to experience the what our bodies are saying, because as I'm sure you've seen many times in your office, you can have a conversation about something that seems like it might be like a 3 or 4 out of 10 on a relationship importance scale, but people have such big reactions and their bodies are very, very stressed by what's going
Right.
on. And you can sort of see that there's something else happening besides just the content, which on its
Hmm.
face doesn't seem so important. It is a lens into all of the dynamics that you were just
Hmm.
talking about.
Yeah, absolutely. And so, yeah, couples work is like rich and chock full of somatic cues, right?
Yeah.
Between 2 partners when we think about that like live system we were talking about.
Yeah.
So, yeah, small moments, looking away, looking at
Mhm.
me, the couples therapist, much
Mhm.
more than they're able to look at their partner.
Yep.
Facing a little angled versus
Mhm.
facing straight on to me.
Yeah.
Um, Lots happening.
Yeah. Getting
Physically.
loud, getting quiet, all
Hmm.
of that. Yeah.
Yeah.
So I want to transition to talking about couples therapy overall, and I guess sort of frame this a little bit for people who maybe are thinking about couples therapy but haven't yet decided to get their partner into it yet, or are on the fence. Um,
Mhm.
what's something that people get wrong about couples therapy, like before they even sit down on the
Mm.
couch? What's a common misconception people have about couples therapy?
Yeah, I think a common misconception is that you need to be like at your last straw as a
Mhm.
couple to like
Mhm.
pursue this resource.
Yeah.
I think that's a big one. I think something else that couples tend to have a misconception about is like what the couples therapist role is. I
Mhm.
think there can either be fantasies or fears about
Mhm.
a couples therapist being like the judge and the
Yeah.
jury, right?
Yeah.
Like there to decide who's right or whose side of the argument is like more viable or
Totally.
yeah, like so I think and again, I say fantasies, right? Sometimes that's exciting for a partner to imagine. Like, I'm finally going to get, the
Right.
justice I've been seeking. And for other partners, it's like, I don't want to go to this place where I'm imagining I'm going to be told that I'm wrong and that everything my
Totally.
partner has ever said is right. And I need to change or else we're doomed. So I think that's not the couple's clinician's role. And yeah, and then that first one, I think coming back to that first one is quite big. This idea that only when a couple is like really struggling or like doesn't know where else to turn, now we'll finally consider couples therapy, or
Yeah.
this is the time to consider this.
Yeah, or like
Um,
I would add to that, people really think that couples therapy is a sign that your relationship is a failure, right? Or that you're really, really in trouble if you're going to a couples therapist. When I don't know
Yeah.
about you, I often wish that people would come in earlier. They often wait too long to
Mhm,
deal
mhm.
with these problems.
Absolutely, and I think something I'd add to that too, Avi, is something back to your original question of what drew me to couples work. I think, we've come a long way in, like, destigmatizing individual therapy,
Yeah.
especially in, like, a city like New York. I feel like we carry a lot of pride as people in the city being saying,
Mhm.
like, I'm in therapy, I love it, it's been so
Yeah.
great for me." But I think couples therapy still has somewhat of a long way to go. I think couples feel a lot of shame in
Yeah.
either admitting that they're in this work and because I think couples are also involved in a lot of sort of performances around like we're perfect, we're great, everything's fine. Because if they were, if people in their lives were to know they were seeking this kind of help,
Yeah.
what might they think of the
Yeah.
couple system, right? You're not meant to be, or you're not with the right person if you have to go and do this thing to help your relationship. So working to destigmatize, huge passion of mine because there's no shame.
I so agree that it's true. There is more stigma around couples therapy, which is funny because like I wouldn't say that many people would like point to having a lot of role models for like what it means to be in a good relationship, and yet we all
Mhm.
somehow feel like we should just be good at this, and it's something that
Right.
comes naturally to people. When in my experience, it doesn't come naturally at all. I think it's pretty hard to be in a successful relationship.
Absolutely. Yeah. And I think couples tend to think it's going to mean something about my partner if
Mhm.
I share with others that we're in this or
Right.
and people who want to support couples in their lives, they often tend to split in one direction or another, right? Like,
Yep.
"Oh,
Yeah.
they're great, like, keep going," or "What? They did what? Like,
Yeah.
leave them now." And I think people try to avoid that split, and then it becomes really hard and confusing.
It's true. We don't do a great job in our culture of sort of like walking the walk when it comes to recognizing that like there are two sides to every story, and that probably both people are playing a role in whatever
Yes.
problem. I know as a friend, I want to support my friend, and I'll be like, screw them, they're wrong, but it's like
Mhm,
probably not
mhm.
so helpful for the long term viability of a
We've all
relationship.
been there. We've
Yeah.
all been there, yeah.
Well, let's go back for a second to this notion of there being a referee or a judge in the
Mm,
relationship, and
mhm,
this maybe fantasy slash fear that people have that you as the couples therapist are going to decide who's right, who's wrong, settle these issues once and for all. What
mhm.
really happens in moments like that? How do you handle that?
Yeah, I think I'm really helping couples become almost like translators for each other because I think when we're distressed as partners, that can often get communicated as through criticism, defensiveness, escalation, and then what's more deeply going on is completely lost. So a
Mhm.
big part of my job as a couples therapist is to help each person like actually hear what their partner is trying to communicate beneath the more protective reactions. So a great example would be like a couple's conversation shifting from a partner saying, "You never listen to me," to saying, like, "When I don't feel heard, I start wondering whether or not I matter to you."
Mhm.
And those are very different conversations. So that's where I'm trying to help partners go or move toward.
Mhm. Mhm. I would add to the notion of there being like of our role as being some kind of a judge where we're going to side with one person over the other. In my experience, I think if there's a winner and a loser in a relationship, like they both have lost,
Yeah.
like you you really want to get your way and have your partner resent you for
Mhm.
the rest of your relationship. Like that's obviously not people's long-term goals. And so that can't really be the problem we're trying to solve. We like to your point, we're trying to understand each other more than
Right.
anything else.
It's like that really important question, like, "Okay, you're right, but
Yeah,
you're right at what cost?" Right? Like,
exactly.
how is your is your partner feeling any better or any closer to
Yeah.
you despite
Which
you being right?
which is a hard thing to accept
Really
when
hard.
you feel right. you know?
Yeah, yeah. And again, I think it's not that right and wrong is like irrelevant to me as a couples therapist, but in a lot of ways it is
Yeah,
because you're both right in having this like internal experience that makes a lot of sense given the history we're trying to explore too.
yeah,
So it's like there's something right about this for the both of you and you're getting stuck.
right, right.
Yeah.
Couples therapists we love to talk about patterns. We love to talk about cycles. I'm
Mhm.
curious, like, I just want to talk about that for a moment. And, it's a pretty common idea in couples therapy that it's not really about the dishes or putting in an effort on date night. Not that those things are
Mhm.
important. There's an underlying pattern to these things. Can you speak to that? What in your experience are common patterns that you see?
Yeah. I mean, a common pattern that we talk about a lot in the couples therapy world is pursuer distancer pattern, right? One partner feels disconnected and is tries to reach out, and in whatever way they're trying to reach out, the other partner feels overwhelmed or criticized or like they're failing, so they pull away.
Yeah.
And then the more that one person is pursuing, the more the other is pulling away or withdrawing, and the more the one is withdrawing, the more desperate the pursuer becomes. I think that's a big one. Another one that's coming to mind is the pattern of I don't feel like you hear me or you listen to me or that there's space for my feelings in this
Mhm.
relationship. And then the other partner saying, well, I just feel like I can't do anything right.
Mhm.
Like there's
Mhm.
always something.
Yeah.
And I mean, this is one of many.
Yeah.
And oftentimes this many falls under some sort of like core umbrellas.
Yeah. Yeah.
Um, but yeah, that's what we mean when we talk about like the cycle,
Yeah.
and not one of you being to blame, but this cycle. You
Yeah.
do this, which makes you do this, and then when you do this, it makes them do more of this, and you're
Yeah.
both getting more of what you don't want from each other.
Yes. I want to throw you a curveball because I didn't give this one to you in advance, but a common, I would say, I'm curious to get your take on this because this feels like an increasingly common
Mm,
cycle in my for a long time. I've been working with couples for over 15 years, and it used to always be more pursuer distancer. And I would say in the last few years, there's a lot more of what sometimes is called like withdraw, where
mhm,
both partners are very conflict averse.
yeah,
Nobody brings anything up. Everyone is upset internally without saying anything. Uh,
mhm,
I often see this as sort of the antecedent to affairs, for example, where
mm.
people are afraid to talk about their needs, but then they'll do something, they'll get their needs met with someone else. But I'm just curious if you see that as well, and do you agree? Is this more common now? What's going on?
Yeah, such a good question. I definitely see this, and I think it's fun is not the right word, but I think there's like so much work that can happen with two withdrawers, and I
Yeah,
think that yeah, the avoidance is serving a function, right? Like they're pulling away from each other or pulling away from hard conversations is sometimes how couples will there'll be an awareness of like,
yeah,
we're moving away from having this hard conversation, but the how do we even have it, the
hmm,
fears around what would happen if they did have it.
yeah,
And then sometimes it's like the fear of the realization of like, what if we have it? And then we realize this doesn't work.
yeah,
And like what we've been waiting or wondering about the other person's experience is really true.
yeah,
And there's a lot of grief and fear in that as well. So yeah, I am seeing withdraw. And I think that work is about helping both people come up back online, and
yeah,
also understanding again what the function of the avoidance has been. This isn't to like villainize the system or either couple or either partner for saying like it's because you two just like won't talk that this is the issue. It's both of them having maybe even similar histories about if I can move away from this,
yeah.
things will get better or I can stay functional.
Yeah, no, I think that's right, and there's something very poignant in what you said, which is like, because I think sometimes it can be, especially if you're like someone more comfortable with conflict, it can be really
Mhm.
hard to relate to someone who's conflict avoidant. And
Mhm.
and as a couples therapist, you see two unhappy people and nobody wants to talk about it. Maybe your first reaction would be like, what are you doing? But I think
Right.
they are absolutely convinced that they will lose each other if
Mhm.
they have conflict, right? And that
Right.
in a way, avoiding talking about these things is a way of holding on to each other.
Holding on to each other. Yep.
Yeah.
And
Even
then
as right, as they disconnect and
I was
don't.
just gonna say, at what cost, right?
Exactly, right.
It's like the couple that fights all the time or the couple that doesn't fight at all, and which one's sort of in a scarier predicament.
Totally, totally.
Yeah,
Yeah,
yeah.
yeah. Um, Let me shift for a moment because you also work with ADHD.
Mm.
And this is a diagnosis that comes up a fair amount, I would say, in couples that I work with, and I think with couples that you work with as well. And
Mhm.
I'm very curious to hear your thoughts on how that does influence couples therapy, a relationship. What are things that couples where one partner has ADHD what should they be aware of or be thinking about?
Yeah, I think, yeah, we tend to see this a lot, like a neurotypical partner and a partner who's neurodivergent, ADHD being sort of one facet of that neurodivergence. So I think one of the misconceptions is just how sort of simplified people's understanding of ADHD can be. Whereas I work really hard through just like helping educate my clients about like just like really expanding the like symptomology, like the list of symptoms and
Yeah.
how ADHD shows up. And so when we think about couples, ADHD is often affecting emotion regulation, organization, follow through, memory, time management, like responsiveness. And we can just, I'm sure anyone listening can hear and imagine all the ways that that can get in the way of like a couple and a couple trying to live their lives together.
Yeah.
Um, so they can over time, like couples can also like develop really painful narratives about each other, right? Like the neurotypical partner could start to feel really alone, like burdened by like all the administrative tasks that come with like being a couple.
Right.
They can kind of start to step into somewhat of like a parental role. Did you do this? Did you forget this? Don't forget to do this. And the ADHD partner or the neurodivergent partner might start feeling, you know, easily criticized, like micromanaged, like they're
Right.
constantly disappointing their partner. And so both partners are really hurting and they're responding to those hurts rather than sort of recognizing the role of the ADHD itself. So I try to help couples separate the partner from the condition, right? And like work together against the problem instead of against each other.
Uh-huh.
This is not to say this is like easy work. It's challenging, but so much like hopefulness can come from even just understanding how the neurodivergent piece is playing a role in the system.
You know, in my experience with just about any issue with a couple, both people have to make some move towards the other person. What do you
Mhm.
think in a situation like what you're talking about? What would be an example of each partner moving a little bit towards the other partner?
Yeah, I think both partners can get more curious about what the other is needing from the other, right?
Mhm.
So like the neurotypical partner can really acknowledge like this is a struggle for you. These things that are maybe easier for me, they're a struggle for you. Is there a way I can help you help yourself? And then
Mhm.
in turn that would help me with these things that I'm feeling really burdened by, and really leaning in gently, moving away from the criticism and
Mhm.
moving towards, I know this is hard for you, and it's also hard for me in these ways when I
Right.
have to manage you and me. Like, help me help you. How can we talk about this differently? For the ADHD partner, right? It's like working against that defensiveness when that partner wants to sort of say like, but I do so much,
Right, right.
or, you know, and really hearing, okay, that this has an impact on my partner. What are small ways that feel manageable for me to help them with what they're asking for? But
Yeah.
yeah, it's a layered conversation for
Yeah.
sure.
Yeah. Well, I also want to add, I think one of the unspoken feelings in a dynamic like that is shame, you
Hmm.
know, where it's like, I've definitely noticed um, any member of a couple who has any kind of executive functioning, struggles are so quick to feel shame about,
Mhm.
because they've have a lifetime of
Lifetime.
being criticized about these shortcomings.
Right.
And so when someone says, "What about all the things that I can do?" I hear the ways they're trying to sort of defend against that shame,
Mhm.
right? Aren't I still lovable in spite
Yes.
of this, you know?
Exactly, right, and then all the other partner hears is the defensiveness, right?
Exactly.
And is not
Right.
hearing what's underneath,
Yeah.
right?
And on the other side, I think more neurotypical partners don't really recognize what they're stepping into when they criticize their partners, right? Something that is a very legitimate complaint. You
Mhm.
know, you're counting on someone to do something and they don't do it. You're rightfully upset, but they
Mhm.
don't really recognize how it's landing
How
when
it's landing,
yeah.
and everything that's come with it for the neurodivergent partner,
Yeah.
right? That's coming on the backs of all of their previous experiences in
Yeah.
their life where
Yeah.
they've been made to feel like they can't get hit the bar
Yeah.
or yeah.
Yeah, yeah, yeah. So I wanna, shift just for a little bit to talking about the body in couples
Mhm.
therapy, and I'm gonna hone in on something in particular because you talked about regulation, you talked about safety, and so in the heat of an argument, when a couple is, um, struggling to communicate and, you know, us therapists, we might say they're getting dysregulated,
Mhm.
what is something that a couple could do to come back to a sense of safety in their bodies so that they can work through what's happening in a more
Mhm.
productive way?
Yeah, one of the simplest things to do is to slow down and even sometimes come to a full stop with
Mhm.
what you're saying and what you can sense your whole body, your whole being is like aiming the objective that you're like leaning in towards. To just slow that down, to sometimes like physically return your torso to the upright position.
Mhm.
Sometimes we talk faster, we lean
Uh-huh.
forward.
Right,
It
right,
looks
right.
different for everyone, right? But um introduce some opposition to whatever's happening in the body. If you're standing up, try sitting down for a moment.
Mhm.
If you're speaking quickly, slow down the speech enough that you can even maybe come to a full stop because we want you to become aware of what's happening inside um, before moving forward.
Yeah.
Um,
Yeah.
Taking a full breath. I think one question that is so helpful, and I want everyone listening to know that this is much easier said than done, and this is like a practice in and of itself. Like these are all like muscles we're talking about that
Mhm.
like need to be exercised.
Yeah.
But a question is like, am I trying to understand my partner right now, or am I trying to protect myself?
Mhm. Mhm.
That can be a really helpful question. And but even a few seconds of slowing down can really create enough space to for you to choose a different response. Because when we're flooded, we're often reenacting and like reacting some kind of survival mode strategy rather than moving any closer to connection.
Yeah. I think that's a great point and one that could be unpacked for a long time, right? Like,
Mhm.
can you feel the difference? Can you feel it in your body between trying to win an argument, defend yourself, prosecute your point versus am I trying to understand? And if you're not trying to understand, then I wonder what your goal is in that
Mhm.
moment in a conversation. But if
Yeah.
not that we don't want to be heard, but if it's only to be heard, you're probably not going to get what you need.
Right. And sometimes we can sense that things aren't getting better the more we speak and the
Yeah.
more our part like we can sense that at least.
Yeah. Yeah.
And sometimes it requires the more regulated partner in that dynamic to say like, I love you, I'm taking 5 minutes.
Mhm, mhm.
Or I'm gonna pull myself away for X amount of time
Yeah.
because I can tell this isn't heading in a direction that is fun for either of us.
I will add, this is a whole other topic we could do in another conversation, but my partner and I basically had to decide that if we were starting to get into an argument over text, we had to call each other because
Mm,
we were never, it's just impossible you're really only arguing
Yeah.
over text, and it's kind of what it's designed for. It, and we just had to like agree that whoever noticed it first would say, let's call each other on the phone.
Mhm.
There was just no way, it was never going to go well.
That's
And
great, and
yeah,
that speaks to how creative couples can get and how, like, clinicians can also help couples get creative,
yeah.
yeah, about coming back to each other.
So I want to kind of end on a hopeful note. So uh, in couples therapy, how can you tell, what are the signs that change is happening? How, what, both in therapy, at home, how do you
Mm.
start to see that?
Um, I see that couples are able to recover more quickly after conflict.
Hmm.
I always say it's not about fighting less. It's about the recovery time feeling less intense and less disruptive. And
And
also,
and do
go
you
ahead.
know like what goes into that? How do people recover more quickly? If someone's watching this and they don't have that experience, what
Hmm.
happens when people bounce back?
Um, what happens once they bounce back, or meaning how do they bounce back
Yeah, like what's it look
quickly?
like to recover quickly versus, days of
Yeah,
not
what it
talking to each
looks
other?
like is both partners can say, "Okay, we're doing it again," right?
Mhm,
Like, how can we each make a different move right now?
mhm,
Like, or how can we slow down? Or, you know, 10 minutes have gone by and now as a partner who has been in couples therapy with my partner, I'm really thinking about that thing that was said 2 weeks ago about how I can become defensive and when my it's that work, right? It's the,
mhm,
like, sort of reflective, "Here's what we've been talking about, and this is what we've been mapping together in couples therapy." And then I also find that couples and when the work is landing, they're really able to give their partner the benefit of the doubt much more often, right?
yes.
Like, they're really able to say, "Okay, before I jump to that belief that they don't care, that, like, they really um, they don't give a shit about what I'm feeling, can I just take a moment and, like, remind myself and maybe even, like, move back to moments in my mind where I felt really cared for by them and kind of,
Mhm,
like, reality test this a bit?"
yeah,
'Cause if I take that train, they don't care,
yeah,
that's I'm not staying curious and I'm not giving them the benefit of the doubt, and that really limits where we can go with this.
yeah, yeah. And
Um
then my last question would be, so for a couple who's watching this, who's on the fence of about starting therapy, what would you want them to know?
mm. Well, something we said earlier, right, is, like, I'd want them to know that seeking help doesn't mean their relationship is failing, and I'd want them to know that a lot of couples wait much longer than they need to,
Mhm,
because they think they should be able to figure it out on their own if they're really meant to be or if they're really with the right person. I'd want them to know that relationships are incredibly important, but that they're also really complicated, so that there's nothing wrong with getting support. You don't have to wait until you're in crisis, what we've been saying.
mhm,
Um, yeah, and I think the strongest thing a couple can do is become curious about each other again before the distance grows too large
yeah,
and those wounds are a bit too deep, and that kind of, like, curiosity or mutual respect feels much farther away. So I think if there's one thing I've learned, it's that people are often far more capable of reconnecting than they believe they are.
yeah.
So if couples are even considering getting help, that tells me a lot about some part of their dynamic. They're still reaching towards connection and, like, a hopefulness for a different kind of dynamic together.
Totally. And I would also just add, I think people underestimate how stressful it is to be in a relationship that's struggling, and how
Mhm.
good life feels when your relationship is going well and
Yes.
you have a real partner, and you feel like you have a partnership. Things
Yeah,
feel easier, you know?
exactly, and I think when a relationship is struggling too, it's also so isolating.
Yeah,
Like, it really feels like, "Who can I talk to about this that isn't
totally.
gonna have a changed view of my partner?"
Yeah,
Yeah, and oftentimes it is hard to answer that question, and that's why we exist as therapists.
yeah. So if couples or individuals are watching this and want to work with you, how can they find you?
Yes, you can find me on the Downtown Somatic Therapy website.
Uh-huh.
I go by Nina or Antonina. You can find me on Psychology Today, and you can simply reach out. And if I have openings, we can schedule a consultation.
Sounds great. Thank you.
Yeah, thanks, Avi.